Health insurance in Park City, Utah. 1. Basic healthcare. These are services that are routine in nature and occur more frequently. A large part of our dilemma today is that patients do not receive these services as much as they should. If it were, these would avoid many complications of illnesses and would assist greatly in reducing higher healthcare costs. 2. Catastrophic care. These are services and care that are more costly and that are difficult to predict the who, what, when and where. They are truly the reason for insurance in the first place, the risk we need to all share to protect one another. Now, if only it were as simple as it may appear to be explained in the paragraph above. The reality is that it is not. This is only part of the reason of why Hispanics represent such a high percentage of uninsureds. They feel disconnected, confused, and basically as outsiders in the large and complex maze that is our healthcare system. Just as important is that our healthcare industry has combined Hispanics as a one-fit-all demographic, and it is not. Although we share many factors that bind us together as a group, there are also many differences and preferences that make us unique. Our healthcare industry has failed to tap into these differences and market to them differently. In addition, there are economic issues that Hispanics face that make their access to healthcare more difficult. It is sad and frustrating that this has not been addressed with as much fervor as it deserves. Hispanics today play a large role within our society, and many struggle to make ends meet without being able to afford and attain quality healthcare. There are many challenges ahead, yet we must fight to conquer this soon. As healthcare reform is being discussed in the halls of Congress, the largest group of uninsureds awaits some answers, and deservedly so. Yet although some level of government assistance is needed, Hispanics do not want handouts, socialized medicine, or a public government-run insurance plan. They want simple and fair rules for everyone.